History taking. We'll discuss about past history, drug history, occupational history, and familial history. Now, importance of past history. Current disease of a patient may be a consequence of complications of previous illness. Example, acute rheumatic fever in childhood, chronic rheumatic heart disease with valve involvement. Example, mitral stenosis. Now, past history of pulmonary tuberculosis turns into bronchiectasis and post-TB infections. Past history of jaundice, chronic liver disease. Now, intestinal operation. Now, it is malabsorption syndrome. For treatment purpose, fitness for surgery, past medical illness is important. For treatment purpose, fitness for surgery, past medical illness is important. Now, drug history. Clinical importance of taking drug history of a patient. Ongoing disease may be known from drug history. Example, hypertension, diabetes mellitus, bronchial asthma, ischemic heart disease, tuberculosis, and connective tissue disorder. Drug hypersensitivity can be known. Some clinical manifestations may be due to side effects of drugs, such as bleeding, peptic ulcer from NSAIDs, postural hypertension from antihypertensive drugs, osteoporosis and Cushing syndrome from steroid. For safe administration of a new drug, as there may be possibility of drug interaction with ongoing drug. Occupational history. Importance and example. Occupational history. Some occupations are known to be associated with certain illness. Some important examples of disease related to particular occupation. Exposure to organic solvent, causes cardiac arrhythmias, cardiomyopathy, and blood pressure syndrome. Then aniline dye workers causes urothelial tumors. Vibrating machine tools causes Raynaud's phenomenon. Vibrating machine tools causes Raynaud's phenomenon. Cold exposure causes angina and Raynaud's disease. Deep sea diving causes embolism through foramen ovale. Causes embolism through foramen ovale. Then shipyard or construction workers are exposed to asbestos. Causes pulmonary causes pulmonary fibrosis, then lung malignancy. Then coal miners are exposed to coal causes pulmonary fibrosis and COPD, chronic obstructive pulmonary disease. Sexual workers increased risk of sexually transmitted disease such as gonorrhea, syphilis, hepatitis B and C, HIV. Garments workers, carpenters and forest workers causes occupational asthma. Exposure to organic solvent causes cardiac arrhythmias. Aniline dye workers are suspected to urothelial tumors. Vibrating machine tools causes Raynaud's phenomenon. Cold exposure causes angina and Raynaud's disease. Deep sea diving causes embolism through foraminovaly. Shipyard or construction workers who are exposed to asbestos are suspected to pulmonary fibrosis and lung malignancy. Coal miners are exposed to coal, pulmonary fibrosis, COPD. Sexual workers to increased risk of sexually transmitted disease such as gonorrhea, syphilis, hepatitis B and C, HIV. Garments workers, carpenters and forest workers are suspected to occupational asthma. Now, family history. Importance of family history. Many diseases have a clear relationship with same disease in patient's relative, father, mother, sister, brother, or paternal and maternal first degree relative. Some diseases are associated with positive family history such as hypertension, diabetes mellitus, ischemic heart disease, stroke. Genetic disease such as thalassemia, hemophilia, cystic fibrosis, hemochromatosis, Wilson's disease, polycystic kidney disease, then Duchenne muscular dystrophy, Marfan syndrome. And Marfan's syndrome. Seronegative spondyloarthritis, seronegative spondyloarthritis, rheumatoid arthritis, then atopic bronchial asthma, colorectal carcinoma, then inflammatory bowel disease such as Crohn's disease and ulcerative colitis.